প্রিয় দর্শক, আমন্ত্রণ আরটিভির সাপ্তাহিক অনুষ্ঠান সুশিক্ষা ও আলোকিত বাংলাদেশে। এই অনুষ্ঠানটি সম্পাদন ও সঞ্চালনার প্রয়াসে আছি আমি জিউ আহসান, নর্থ সাউথ বিশ্ববিদ্যালয়ের স্বাস্থ্য ও জীববিজ্ঞান অনুষদের ডিনের দায়িত্বে নিয়োজিত। আমরা জাতীয় প্রয়োজনে এই অনুষ্ঠানের বিভিন্ন পর্বে কর্মমুখী সুশিক্ষার সুযোগ ও তার সম্ভাবনা নিয়ে আলোচনা করছি। আজকের আলোচনার বিষয় ইন্টারন্যাশনাল কংগ্রেস অন এইডস in Asia and Pacific 2015 and quality medical education। এই আলোচনার জন্য স্টুডিওতে উপস্থিত রয়েছেন পার্টনার্স ইন পপুলেশন ডেভেলপমেন্টের নির্বাহী পরিচালক জো থমাস। Welcome, Mr. Joe Thomas. We are really happy to have you to this program. You are presently working for ICAAP12, and ICAAP12 is a big occasion for Asia and Pacific region country for creating awareness on HIV/AIDS and leading HIV/AIDS program for achieving 3 targets. And our government, particularly our Prime Minister, is the chief patron for hosting ICAAP12 in Bangladesh, and you are entrusted and honored with the position of the Secretary General. In this situation, what is the significance and prospects of Bangladesh for organizing such a wonderful program?
Thank you for inviting me to RTV studio to discuss about 12th International Congress on AIDS in Asia Pacific, and this will be held in Bangladesh in November this year. This is one of the prestigious health related scientific conference in this region. We are expecting about 3,000 to 4,000 delegates from Asia Pacific region, about 52 countries, and also internationally from Europe and United States. The most important feature of this conference is this a combination of science, community services, policymakers, administrators, government officials, parliamentarians. So people from various dimensions of life and the society is going to come, and they're going to discuss about health in the broader context. They're going to discuss about HIV related prevention, care, treatment, and in all aspects of HIV response in this region in the nutshell. And then we are expecting a large opening ceremony, closing ceremony. So in a day, we are expecting about 100 to 150 scientists and experts speaking in a day. And,
What we understand is very significant for our country hosting such a big international events, first of this kind in this country. And our government has demonstrated high level of commitments. Our Honorable Prime Minister has sent her message in ICAAP11 that is held in Bangkok. Also, she is the chief patron of this program. So considering everything, what would be the expected benefits our country could get from this ICAAP12?
Right. You know, first of all, I work as the Secretary General of this International Congress, and in my capacity as Executive Director of Partnets in Population Development, PPD for short. PPD is a consortium of 26 developing countries, and Bangladesh government is hosting. The secretariat is, the international secretariat is based in Bangladesh. So in that capacity, we are committed to provide technical support to Bangladesh government. So when the senior officials, including the minister from the health department, when they suggested the possibility of hosting this international conference, PPD opted that we will be happy to provide that technical support. So we did the bidding, technical proposal, and also meeting with the negotiation. So all those technical support we provided, and that is our mandate, to provide technical support in the area of population development. And this will have significant contribution in various aspects. One is this an opportunity for policy dialogue in the area of health, particularly Bangladesh's preparation towards post-millennium development goal, what we call it as a sustainable development goal. So we will provide a platform for policy dialogue in that area. Second, this will attract large number of scientists and researchers from other countries. So that will strengthen the Bangladesh response to HIV/AIDS,
right,
by building the capacity, building the expertise, and also this is an opportunity for scientists and researchers and academicians within the country to establish links with other countries.
Yes.
So those strengthening the relationship is an important part of it.
Thank you very much. So as I learned from your discussion that it will be a very big opportunity for image building for our nation if we can organize this conference efficiently and successfully. for building our image, do you have any plan from beginning to ending to have some of the activities within the conference?
And definitely this will contribute towards building the image of the positive image of Bangladesh. See, for instance, there will be, we are expecting about 25 to 30 health ministers will be coming, and two or three heads of state will be coming. So their coming to Bangladesh itself is an opportunity for increasing the profile of Bangladesh.
Right.
And also this is an opportunity to demonstrate that Bangladesh can do significant, serious scientific conferences.
Right.
And also third thing is that the convention and congress industry is an emerging industry in South Asia, in Bangladesh. So this will provide experience for the large number of people how to organize large number of conferences. That is a significant contribution. And also we could see that there will be contribution towards tourism department, transport department, hotel industry, airlines industry. So this has got what we call it as a ripple effect. But most importantly, this is going to help strengthen the health systems of Bangladesh. Doctors' capacity is built, the patients' capacity is built, and also the policy level, how better policies can be created, an opportunity to review the program. And also this might attract financial contribution from other countries.
The funding channel could be opened
up. Research channels could be opened.
And also, right, we can demonstrate some of our successful achievements and awards that is received by our government, by our peoples in health and HIV/AIDS or health related areas. What do you think?
See, there are some significant achievements reached by Bangladesh government, Bangladesh people in this country, particularly in the area of reduction of maternal mortality. But still we have to work on it. The maternal mortality means there are pregnant mothers die when they deliver a child. And that is one of the serious difficulty in this country. But that number has reduced significantly. And also similarly, neonatal mortality, the small children
reduced significantly.
Maternal mortality, infant mortality reduced significantly.
Right, life expectancy.
Life expectancy has increased.
The education rate.
And overall, particularly girls' education is improved.
And
the
female
education improved, and girls' health status improved. So there are some significant achievement, and this is not understood many countries outside the
and the economic development
and also and overall economic development. For instance, many people assume that Bangladesh is completely depending on other countries, what we call it as overseas development assistance.
Right, and another important domain, I think, if you consider like using less money. More significant achievements in terms of per capita expenditure for health and related areas, and achievement is much bigger. That is published few days before in Radisson conference by the Ministry of Health and Family Welfare.
See, the thumb rule is that any country to reach some significant level of health status, you have to increase your financial allocation for health should be to the range of 7 to 8 to up to 15% of the GDP. But Bangladesh right now is approximately 2% of the GDP is invested in health. But with the 2%, there is a significant achievement. And the world famous journal Lancet, they call it as the miracle in Bangladesh.
Miracle in Bangladesh.
The health miracle in Bangladesh. But still we don't know exactly how it worked out. It's literally a miracle.
And that is published in Lancet, one of the high level of international journal. And also our Prime Minister
received an award.
UN Nations, the Millennium Development.
So this gives an impetus, and look at carefully that what else we have to work on that. See, for example, maternal mortality, still we have to work on reducing it significantly to a manageable level. And maternal mortality is still an issue in the rural areas particularly. And also overall health issues we still need to work. And when you look at Bangladesh health, what you might remember is that the critical, what we call it as social determinants of health, are not under the control of health ministry.
Exactly.
See, for example, the increasing number of road accidents.
But
the road accidents contributing towards the bed occupancy in the hospitals. The number of people die through road accident is very high here.
Yeah.
But those things are not within the Ministry of Health.
Right.
For example, the issue of vector control, very
Vector
particularly
control, food safety.
Mosquito control. Whereas
mosquito
this may
control.
look a very small thing.
Yeah.
If you invest significantly in mosquito control, that will reduce malaria. There are many mosquito-related infection could be reduced. Clean water. And Bangladesh there's an abundance of water, but the distribution of clean water, we need to invest more on that. And also food safety.
Yeah.
We know that even the fresh vegetable we'll get it, but even the fresh vegetable and fresh fruits, there's a possibility of contamination.
Yeah.
So if you control on these three areas, what we call it as a critical social determinants of health, we are trying to bring together a significant number of investors from Asia and Arab countries.
Other countries
to invest particularly in the area of health.
Yeah.
That investment is in the area of diagnostics, in the area of service, area of health education, medical colleges.
In the quality of health services.
Improving the quality of health services. And also we look at reviewing the capacity and policy issues and human resources. So this is what we're expecting to do it in the conference. And also health ministers themselves will be looking at how they can learn from the different countries, what they can learn from Bangladesh and what Bangladesh can learn from other countries.
They can take some learned lesson back to their home for their policy implication and operation. Thank you, Joe. Now we'll be having a little break and then we'll be coming back again to discuss about the quality medical education. দর্শক দেখছেন স্বাস্থ্য ও শিক্ষা নিয়ে সাপ্তাহিক অনুষ্ঠান সুশিক্ষা ও আলোকিত বাংলাদেশ। এই পর্যায়ে নিচ্ছি বিরতি, ফিরছি একটু পরেই। সে পর্যন্ত আমাদের সঙ্গেই থাকুন। দর্শক আবারও আমন্ত্রণ স্বাস্থ্য ও শিক্ষা নিয়ে আরটিভির সাপ্তাহিক অনুষ্ঠান সুশিক্ষা ও আলোকিত বাংলাদেশে। আপনাদের সঙ্গে আছি আমি জিউ আহসান। Dr. Joe Thomas, welcome back to discussion. Now we are interested to share your experience about the quality medical education in Bangladesh.
When we look at the number of doctors in Bangladesh, and also comparing this with the number of other health providers, for example, nurses and midwives. So I would say this is one of the significant issues Bangladesh health policy makers have to look at it. We have more doctors than nurses and midwives. Any other country, if you compare with it, to make a significant health impact, you have to improve or increase the number of midwives and nurses.
Right.
So this is one of the issues. We have the reverse pyramid we call.
Reverse, human resource pyramid.
Human resource pyramid is, that probably we have to expand the base in the primary healthcare provision. So, and you also have to remember that in many countries, they're talking about nurse practitioner. Means there are certified nurses, they run primary healthcare.
Oh, it's interesting. Nurse practitioners.
They call it as nurse. For example, Australia, there are licensed nurse practitioner. And they run primary health program in remote areas and rural areas.
And they can manage it.
And they can manage it. Because if you look at a health in a primary healthcare setting, the kind of diseases and infection that we can say about 5 to 10 basic issues. See, if for example, take the case of diarrhea, take the case of respiratory infection, take the case of childhood infection, maternal mortality. If this can be managed at the rural level, and then you should have a triage system, means you should have a system in which when there is a expert advice is required, you refer to them to the nearest hospital, district hospital or tertiary hospital. This can be done by if there is a trained and experienced nurse and sometime under supervision of another doctor. So strengthening the primary health care is an important thing. So strengthening the primary health care where the existing medical education is helpful, I have my serious doubt about it.
So this is one point that our population and the human resource distribution is not properly maintained.
There's a need for looking at it carefully. There's a need for further looking at it. And also, I would say that you have to look at the issue of the syllabus.
What is the management abilities of our health service providers?
See, the management also, there are the procedural issues, there are protocol issues, there are guidance issues.
Right.
So, see, for example, any hospital procedures, and also the number of people we can cope with in the hospital setting. And most of the hospital, they're overcrowded.
Right.
And overcrowding is matter of various aspects. One is it's a matter of, see, some disease, the primary health issue can be dealt at the primary center.
So it's the management and policy issues.
It's a management and policy issue to some extent.
Yeah.
And so also I would say that the doctor's training issue.
What do you think, what is their role for ensuring quality education?
See, the quality of education is responsible to the government to control it and set the standards. So that medical council and also government has to set certain basic minimum standards. For example, you may remember that Bangladesh is known for sending workforce abroad, and eventually there is some percentage of workforce also will be trained doctors and trained nurses. So we should also think about the quality of education, medical education from that point of view. We are producing medical doctors, nurses and midwives not only for the local needs.
Market, for not only for our nation.
Yeah, and also this is, you have to think about in the future, say, take the case of Bangladesh export of the human resources.
Yeah.
We may have to factor to 10 to 15% of the manpower export in future, next 10, 15 years, should be doctors, nurses, midwives. Along with that, two things happen. Number one, specialization. And number two, the issue of, I would call it as broadly, the ethics of healthcare. That's not only for nurses, I would say the doctors. If you look at the doctors'
ethics,
syllabus,
that is very important.
Ethics of the clinical ethics, there are very limited emphasis in that way.
So call it medical ethics
or bioethics. Or bioethics.
Yeah, bioethics.
Yeah, so bioethics is not taught, that's not part of the syllabus. Even public health education, the faculty of bioethics should be much more prominently brought up. This has got many aspects, not only the service delivery. You should remember that Bangladesh is also largely involved in clinical trials. The clinical trials should be under the broad umbrella of bioethics.
Bioethics, exactly.
And when the pharmaceutical industry expands, there is another market also expand, clinical trials. Clinical trials, if it's not done under the very strict bioethics protocols, that will that will compromise the life and quality of life of people in Bangladesh. So from that point of view, we have to have a strong emphasis on bioethics or ethics of healthcare providers in our medical education.
It's a very important suggestion, Right now, I like to listen from you about the big number of the young population in this country who are planning actually for their future career and their education plan. Most of the young population are interested for university degrees in the form of general education, but more job opportunities is around these areas like medical technology, nursing, information technology, public health. So what is your message for those young population?
Particularly Bangladesh, getting in the area of information technology, software industry, and also I was listening to the president's speech today. Bangladesh is also going to send a special rocket to the space. So these are also opportunities for employment.
These are the developments.
The technical development. But are we preparing ourselves, our young people, to get into that way?
Yeah.
But education point of view, I don't think anything wrong in people aspiring for higher education. Even now, the students or young people going to universities very microscopic. 2% of the national population. Of that way, there are still large number of young people aspiring to get higher education.
Yeah.
But higher education has to make sure two things. One is the education what they're receiving is relevant, quality assured, and also oriented towards future employment. And also probably at some point in time, Bangladesh government may look at a national survey of human resource requirement on various sectors.
And
also specific policies on what areas they're going to priority, IT sector, information technology, banking sector, other exploration, even oil and natural exploration. Bangladesh got blessed with natural gas. So expansion of those areas. But most importantly, Bangladesh is still an agricultural society, agrarian society.
Yeah.
The investment in the area of agriculture and also industrialization in the area of agriculture. So that too there are large expense. But my area of interest and expertise in the area of health. But the health sector itself, there are opportunities of employment, opportunities for expansion. For example,
most importantly in the technical areas.
Technically, for example, servicing the equipments in the hospitals.
Yeah.
What I noticed that there's
sometimes the equipments are not functioning.
There's a large number of modern equipments are brought in even the government sector and private sector, but we don't have the capacity to service those things because there is no localized servicing
the technical team
for that. You would wait for somebody come from other countries to even to open the box. So that way, the human resource planning in the area of health service, health sector, you need much more proactive planning. For example, servicing medical equipment and also manufacturing medical equipment is an important thing. Diagnostic facilities are manufactured locally. So these are the future scope. And also medicines are increasingly exported to different countries. Manufacturing of the basic chemicals for manufacturing medicines. Because the basic manufacturing materials are brought in for other countries. We don't manufacture the basic essential chemical ingredients locally. So these are the areas which still there is a room for expansion. But that is not carefully mapped and not carefully monitored, carefully surveyed, and to see that the area of expansion in pharmacy. What are the human resource requirements?
Thank you, Dr. Joe Thomas, for your kind presence today.
Thank you very much, and thank you for inviting me, and glad to be part of this debate and discussion. Thank you very much.
প্রিয় দর্শক, আজকে আমরা আলোচনা করছিলাম ইন্টারন্যাশনাল কংগ্রেস অন এইডস ইন এশিয়া অ্যান্ড প্যাসিফিক 2015 এবং কোয়ালিটি মেডিকেল এডুকেশন নিয়ে। আমাদের দেশে আন্তর্জাতিক মানের এই কনফারেন্স দেশের ভাবমূর্তি উজ্জ্বল করবে। এই কনফারেন্সের সফলতা এবং কোয়ালিটি মেডিকেল শিক্ষার জন্য সংশ্লিষ্ট সকলেই দায়িত্ববান হবে। এই প্রত্যাশায় শেষ করছি আজকের অনুষ্ঠান।